All right, here we go. Good morning, Neil here yet again with a continuing series of Who's Who in Santa Cruz. This is episode number 5 with Amber Williams from Janus. So, can you just describe right now what Janus? Because I want to say something, but can you just tell people what Janus is all about?
Thank you, Neil, for having me.
Of course,
by the way.
of course.
Janus is a substance use disorder treatment center that has been operating in Santa Cruz since 1976.
Right.
And was
I
found,
knew it's been here a long time.
yeah, about 48 years, and was founded by a gentleman by the name of Dr. Robert O'Brien, a physician
Okay.
who wanted to help a family member
Right.
for alcoholism at the
Right.
time, 48 years ago.
So does every town have one of these, or does every city have one of these, or are we lucky to have Janus?
I think that not every town and city has one of these. I think the unique thing that Janus brings to our community here in Santa Cruz is we have everything in the continuum of care.
Yeah.
From high risk withdrawal management, someone needing help to come get detox
Right.
for using fentanyl, all the way to someone getting their first time DUI and needing to do a DUI class.
Okay.
So everything in the spectrum or continuum of care, we call it,
Okay.
from a DUI class for first offender or a wet and reckless
Right.
3-month class,
Right.
or needing intensive outpatient treatment for methamphetamine, medication assisted treatment. So if they need
Checking this
buprenorphine,
thing works. Yeah. Go ahead.
we do everything in the continuum.
Yeah.
So I think that's what's unique about Janus. There are communities that have treatment facilities like residential treatment
Yeah.
or a DUI program, but to have it all in one organization is what's unique.
She's getting refreshments here, ladies and
I know,
gentlemen.
isn't it amazing?
She's getting refreshed.
This is Christine. She's amazing. She's my executive assistant.
Amazing. I'm going to call you AC for short. Amazing Christine.
Yes, she's
We're going to call
awesome.
you AC.
She takes good
Yeah.
care of me. And really, it's about the people. You know,
What's that?
That is a
That looks
pumpkin.
like breakfast, lunch, and dinner.
No, that's a venti pumpkin cream cold brew. I get
Damn.
half sweet because it's less calories. But yeah, I mean, it really takes people like Christine, like the staff here, to make this thing go. And people that have passion and drive to work in nonprofit healthcare and to be on the forefront of trying to help individuals in our community and reduce stigma. I mean, we know stigma's huge.
Right. I have a story.
Yeah.
I'll tell it. You ready?
Yes, yeah.
So I'm thinking how long ago it was. Probably 30 years ago, I got a DUI, right? And here I am. I got been told I got to come to. I think the judge goes, okay, you got to pay this, and you got to go to Janus. So I came here, and I'm like, oh, cocky kid, cocky.
Mm-hmm.
Well, what the fuck am I doing here? You know what I mean?
Yeah.
Like, I have no business being here. Blah 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 blah.
I'm not one of them.
I'm not one of those. And I just looked at one of the classroom areas. I'm like, I was in that room. I just walked up the stairs and go, I remember that. And to this day, her name is Tracy Van Hoyt. Do you know her?
I do know her.
And her and I are friends on Facebook.
She recently retired
Did she? Well, she lives
from
up in
public health, right?
I don't remember what she did, but she does. But she lives up in the lower Sierras, I think. I forget where it was. But to this day, her and I are friends on Facebook. She kind of like checks up on me.
That's
because
great.
that day, when I had to go sit with her, she goes, well, let me talk to you about it. And I'm like, she was like, okay, I got to go talk to this woman? Oh, yeah, I can out-talk her, right? No. And she's asked me. She told me, and I was an alcoholic. I'm going, bullshit. You're like, no, you are. This is why you are. And here it is, right here. And I go, no. You know what? She was right.
Yeah.
And to this day, I mean, I'm gonna say hi, Trace, because I'm gonna send this to her, because she, to this day, she's still kind of like,
Checking on you.
uh-huh.
And that's what it takes. That's the kind of people it takes to work in this field, to help people change and find change for themselves.
You're gonna want to help people,
Yeah.
right?
It's hard work. It's not, some days we joke, when we've had a really hard day around here, which happens,
Right.
because we're dealing with the human condition.
I can't think of any. There been too many easy days.
No, they don't
I
really
swore I
exist.
never came back here. I swore when I left here, I'm not going back ever going back there.
Yeah, it's hard.
And I didn't until today.
Yeah,
And I
well,
recognize it.
thank you for coming back and doing this.
Yeah. So everyone knows I don't normally go with questions, but this is important. This is very important. So today,
We have questions.
got my ribbon. What's my ribbon about?
You know, every September, there's a thing called National Recovery Month,
Okay.
and it's where we get to celebrate our staff, the clients,
Yeah.
their successes,
Yeah.
celebrate how our staff practice healthy self-care because this work is so hard, and we get to go to the Capitol and work with legislators and educate them about substance use disorder.
Okay. It's in September?
That's in September every year, and Janus has a lot of activities we do to celebrate
Okay, I got-
National Recovery Month.
Question number 2.
Yes.
Question number 2 is, I don't even know, what the heck, how did you get this gig? Okay, I'm going to put it in my own language here. How did you're the CEO, right?
Yeah, I guess that's what they call me.
Which is, CEO is like, very important. So what's your background? How did you get to be CEO?
Well, I arrived here as a young, cocky, like you said, lady
Yeah.
who needed help.
Or you were like me?
Yeah.
Yeah.
And I was 17,
Wow.
and
Yeah. Living with mom and dad?
showed up,
Living with your parents?
My dad, my
Yeah,
mom left
okay.
when I was 6 months old. So I had a single father and 2 brothers. And basically showed up here at 17 needing help. And they didn't treat youth at
They
the
didn't treat
time.
youth?
So I went to the camp.
Yeah, up in Scotts Valley?
Uh-huh.
Yeah.
And then came back here.
When you were 18 or?
Yep. And went through our women and children's facility. I have a young son. He's right there.
Hello, lad.
And he's now a lineman, like a PG&E lineman.
Okay.
He's 22. And at the time, I had him and needed some direction and support, and went through our perinatal program and did about 10 months of treatment with Janus. And
How old were you when you had him?
17.
Okay.
And I wouldn't leave. I just sat on the couch until Nancy Napoli gave me a job.
So instead of so you were like kind of lazing around on the couch, and they gave you
I said, I'll do whatever. Take the clients to meetings. I'll file paperwork.
anything,
Anything.
right?
But I'm not going away because I feel safe here.
Okay.
And so since then, it's been 21 years I've been with the organization.
When did you become a leader? Like you can be kind of like.
Probably about 6 years ago, I became the chief compliance officer, director of admissions. So I worked downstairs, and I did a lot of direct line service as a clinician for many years here, and then moved into admin, had to just pull towards compliance and regulations, and moved into that side.
Okay. Can you tell me how this place operates, from
From a client perspective?
yeah.
So
So how do you get here? I mean, how does it work?
So
What-
we have, most recently, we implemented a thing called open access. I wanted us to act like an urgent care. Instead of people having an elusive like wait time or having to make a phone call and schedule an appointment that they may never show up to, we know when someone needs help and they're in a moment of clarity or they're having a moment of clarity, they need it now, not tomorrow, not next week, not an appointment 10 days from now.
Okay.
They need care now. So it's been about a year and a half, and we implemented open access where you can walk in for detox. So we have walk-in daily detox from Tuesday to Friday, 8 to 10 in the morning, and we take the first 6 clients that show up, and we do that every day until we're full, and we continue to do that. So we know that we can't meet the need now that the community has, but we're growing and expanding so that we can continue to meet the need.
Better than nothing, right?
It's
You can't-
way
you can't-
better than nothing.
You can't house everybody, but you can't treat everybody, but it's better than nothing.
Well, and I think it's better than having an appointment that, we had a 50,
Well, we do that.
60% no-show rate.
When we do that, I call my doctor and I call to get my, what do you call it, skin checked. I was like, well, you can come in February.
Yeah.
February? It's October.
And
Yeah.
exactly.
What do you call those people? The skin guy.
Oh yeah, the dermatologist.
Dermatologist. Thank
Yeah.
you so much. Yeah, we can see you in February.
Yeah, and even for us individuals that can manage a calendar and appointments,
Yep.
it's we're like, when was that appointment again? So you could imagine the clients that are houseless in our community
Yeah.
to be able to show up for an appointment,
Right.
or have a phone,
Right.
or get their medications refilled. So I think being able to offer that walk-in care is extremely important.
Question number 5, we've down to. She's got a lot of questions. Question number 5. We talked about this a bit before the show started. New projects you can expect to see from Janus is the sobering center downtown, right?
We're really excited about it, in partnership with the sheriff.
Right. Excuse me.
He rebuilt that building there. It burned down a few years ago, and then prior to that, during the pandemic, we closed the sobering center, and now we get to bring it back. The sheriff put a beautiful new building there for us.
Yeah.
I'm extremely grateful for that. And so, in partnership with the
Paid for
sheriff,
paid for by the state.
paid for by the county, I
Okay.
believe.
All right.
In the sheriff's office, that has been one of Jim's biggest
Hurdles. We call it a hurdle.
a hurdle, and just one of the things he values the most in the community is getting our officers back on the street to do the community policing that they should be doing.
Right.
And dealing with substance use disorders and sitting at the jail waiting to book someone for a drunk in public or under the influence in our community. Why? When you can drop them off for us and we can get them the help they need,
Right.
connect them with services. So the Sobering Center is coming to a theater near Santa Cruz,
Okay.
January 2nd.
So the people that go there, or the people that come here, do you find it's the same people come through here, or is it a variety of people that come here?
I think if we look at it, there's a variety of people.
Okay.
When we used to just have this appointment-based system,
Yeah.
it was the same people coming through. But now, since we've opened it up a lot, we know 1 in 5 individuals struggle from some substance use disorder. That is a huge amount
Yeah.
of the population.
Right.
We know that overdose, which we now should be calling poisonings, because our children aren't intending to take fentanyl and die,
Right.
but they are.
Yeah.
So it's a poisoning. Has tripled in numbers. So
Locally or
locally, nationally,
Okay.
all over the country, the numbers are
That's
skyrocketing.
scary stuff. That's scary.
And it's hitting our children. There's no in high school we'd go out, go to a party, go have fun. You can't even take something now without the
Right.
risk of dying.
Right.
So our
I'm
youth.
interviewing a gal. I can't think of her name. She lost her kid. He was a surfer. Yeah, took the wrong thing. Mm-hmm. That was it.
Yeah, it's really disheartening right now. And so
That sounds like something that you can't even fix that.
no, we can scratch the surface,
Right.
and do prevention. There's great organizations in the community that do prevention work in the high schools.
Yeah, but you still. Yeah. Right.
Yeah, so they get to do some of that early work. We do the high risk side of that work.
Right.
We do some prevention, but it's mainly DUI program and on residential withdrawal management care.
So going back to the sobering center real quick,
Yeah.
just finish that. How many people how many people will that hold?
There's 10 beds.
Okay.
And about 30% of the population, 30% based on numbers previously gathered, will be first-time DUI offenders or like wet and reckless. Those individuals roughly stay in care with us for 4 to 6 hours. And a family member comes and gets them.
Right.
We enroll them in a DUI
Right.
program,
Right.
and they're off.
What's the DUI numbers? Are they growing? Are the people figuring out that you can't drink and drive?
They're growing from the results of so many individuals being stuck at home for the pandemic.
Yeah.
We know that suicide rates are growing.
Yeah.
DUI is growing.
Right.
Use of substances is growing.
Right.
So mental health issues, depression, anxiety
Right.
is growing.
We had a DUI show at the boardroom skate shop with my co-host who got he drank 4 or 5 Mai Tais, but we did it. It was all time done with CHP, Aaron Ching, you know, Aaron, right? And his force were there, and basically, I mean, my friend got schmammered, but he just tells you what you can, what you cannot do. Basically, in the end of the show, basically, you can have 2 Coors Lights, then you're done.
Yeah.
You can't have anything else. That's about all you can have.
Yeah.
Right?
Yeah, absolutely.
After that, you're toast.
Yeah.
So.
And now with Uber and Lyft and all
Right.
these taxis, means to get around,
It
it doesn't make sense to drive.
Yeah.
Yeah, so the sobering center, about 70% will be drunken publics and under the influence, and some walk-ins.
Interesting question here. What difference is Janus from other addiction treatment centers? Are there other addiction treatment centers in town?
There's Encompass Community Services.
Yeah.
They have residential DUI outpatient, and they do some mental health work as well.
Okay.
And then there's Sobriety Works, which is an outpatient treatment center.
All useful.
All great services. I think if we're really good here in Santa Cruz, we're small enough that we can collaborate with each
Do
other.
you guys collaborate?
A lot.
Okay. The future of addiction treatment future of addiction treatment. I mean, this the whole thing with poisoning. How do you even tackle that? How do you...
I think approaching substance use disorder as a medical condition is our only way out of what's happening right now. For so many years, it's been treated as a social condition, and I think the community that isn't directly educated or have family members that suffer substance use disorder look at it as a moral condition or a moral failing. And I think we need to shift our view to this is a medical condition. It is in the DSM-5, the Diagnostic Statistical Manual of Conditions, and it needs to be treated on that platform, on a medical platform.
Okay.
Yes, there's social interventions that are done, 12-step meetings, who's your friend group, how are you staying connected, going to therapy. Those are all social interventions that we use too, but also looking at it from a medical standpoint, that there's medications out there to help support you, that there's getting the medical community on board with seeing it that way will help individuals get help earlier because it reduces stigma.
Yeah.
We know our clients are already suffering and have their own self-doubt and judgment about care.
Yeah.
So really, it's about reducing stigma and educating our community.
Yeah. Is our community educated? I think the community is educated. We're smart, but the Santa Cruz is a very smart town,
Yeah,
right?
yeah, absolutely. And knowing that, like for Janus,
Hey, look at that. I am question number 8. Can you provide
already ahead.
examples of success stories or patient testimonials? I just gave one.
Yeah,
My
we
own
have-
personal one.
and there's so many like that
Right.
we don't even know. 1 in 5.
I'm sure plenty of people have been through here that I know.
Yeah, me
They don't
too.
say nothing, but I mean, I've always said it, but I don't care.
Yeah,
It was 30-something
48
years ago.
years we've been here.
48 years?
in this spot. So
Right. Okay, we're moving along. Apart from me showing up here, with my phone and $30 microphone and $25 stand,
I need one.
I tried expensive stuff, but I just break it.
I love it. That's great.
What ways do you engage with the local community and raise awareness about addiction? Am I it, or do you have? Can you keep the pulse going out there?
Yeah.
That Janus is here 8 years.
Yeah, I think that's where we're at now, is really trying to get us on that front, like on social media, thank you, Neil, for coming, educating the community here. The news came recently to do a piece on the sobering center.
Were they dressed better than me?
I don't know. He had a button up. That's probably the only difference, huh?
I don't know.
But he's not from here either. He's not from Santa Cruz.
He's not.
And you're
That
from
doesn't
here.
count.
You're
That
from
doesn't
here.
count. No, he's out.
You're from here. Sorry, Jose. So yeah, I think just starting to get out there and outreach and educate and be in the hospital, develop a media toolkit. We were a small mom and pop nonprofit. And so we're growing now
Right.
to be.
Who pays this whole thing?
It
Who
depends.
foots the bill for Janus?
It depends on so many factors. We have 53 roughly streams of revenue. So it could be
Oh,
anywhere.
so you got like an octopus with
Yeah,
53 tentacles out
Yeah,
there,
I mean,
right?
it could be grants,
Okay.
federal, state, local grants.
Okay.
It could be Medi-Cal or managed care plan, the Alliance. It could be private insurance companies,
Okay.
commercial payers, Anthem, Aetna, or self-pay clients too, and then donors. So
Okay.
it's a host of funding streams that help Janus
Just like that,
grow.
right? Mm-hmm. Some of the offers you take. Yeah.
It depends what it is. If
Yeah.
it's in alignment with our vision, yes.
Here's a good question right here. How do you prioritizing the well-being of Janus, the staff you have here? I mean, sometimes you got to be like, if I was a staff member, like, I don't want to go to work today. I got these people are like, holy, they're screwed. They're not doing well. They're not, they're not happy. It's
Yeah.
like, is the staff member, excuse me, staff member over there, AC over here, do they feel like they're swimming upstream the whole time? Or are there some success stories where they go, hey, you know what? We did good here.
I think that we have learned over the past 10 years
In
how
other words,
better to
what's
take care of our staff.
Right, and how do you're the CEO, how do you keep the morale up of, unless you just give them coffee all day long?
I mean, we do definitely give them coffee.
Yeah.
Coffee happens, donuts happen.
Right, okay.
We do food like downstairs, I think.
Do you have those custard-filled ones, those donuts, the custard-filled ones?
I'm sure they get them, but they bring
Those are
boxes of
the brute.
donuts, leave them in the
Where are they at?
staff lounge downstairs. I think
Okay.
there's. I
might have to go in there for.
I think shout out to Nate, our kitchen
All right.
manager, who did. I think there's eggs and bacon down there right now to feed the staff.
All right. So how do you keep the morale up?
Well, I mean, we provide them therapy.
Yeah.
We have
Therapy's not much fun either.
No, but at least they can address what they're seeing in their day-to-day work here because it's so challenging and it's hard because you can't talk about it because of confidentiality.
Are women more acceptable for therapy than guys are?
Well, we know that there's a higher prevalence of substance use disorder in men.
Okay.
And less in women. We
Okay.
see, we treat more men here than we do women
Okay.
overall. So,
Guys, get it together. Here's a good one, right? Biggest challenges and opportunities. Let's see. Biggest challenges would be the poisoning right now, right?
I think
Fentanyl's the biggest
fentanyl
challenge.
poisoning is the biggest challenge, and stigma would be my top two.
Stigma. Okay.
Just the people viewing addiction as a moral failing instead of a medical condition is one of the biggest hurdles we're facing in being seen as a medical organization.
Do you know how to deal with it?
Huh?
Do you know how to deal? Is it dealt differently with each individual?
I think it's about going around the neighborhood, introducing yourself. Myself, our neighbors here have my cell phone numbers, our C-suite teams
Right.
numbers. If something comes up or they see a client that is
Yeah.
doing something in their yard, they can call us and
Yeah.
we're available.
Okay.
That's a start.
Yeah.
Educating the community.
Okay.
I think stigma is going to take some time, but if we all speak up and talk about it,
Right. What you
Then-
doing today?
yeah.
Okay. Final question. Da-da-da. Drum roll, please. Here we go. Drum roll. Keep rolling. Have a sip of coffee.
Okay,
Take
I'm
a
on
sip. This is big right here. Okay, you get one message about Janus and the future of Janus. What do you see? What do you see this place being? Yeah. What year are you in right now? Year 48? 47?
Year 48.
Okay, your 50th year. Big celebration. Big fireworks. There's going to be a big party.
There actually
Where-
is.
The one key message about the future. What is it?
The key message of the future of Janus is that we are hopeful by year 50 to have very beautiful environments in which our patients can heal, that are stigma reducing and have empathy,
Right.
and that we're an organization that treats the human condition. And we're here to help. And please reach out if you want education or need to understand something better. You're welcome to call myself, Amazing Christine,
Yeah. We'll come,
and we'll help
we'll
educate
just walk
you.
in the front door.
Or walk in the front door.
Yeah.
Reach out. Put your hand out
So
there.
your future goal is actually to have nobody here, empty. No one has. We don't have a problem anymore.
That would be amazing.
You have no job.
That would be amazing.
You'd be up on the beach reading a book.
I would be fine with that. If that meant substance use disorders was obliterated, absolutely. I don't see that happening, but I
don't
would
see
love
happening
that.
Either. Do you think Angela Chestnut? What she said? How was this interview?
Great.
Did she like it?
Oh, I think she would love it,
All
don't
right,
you?
Thank you. You're awesome. Thank you.
Thank you
Thank
for
you
your time.
You're welcome. And thank you all your staff and all you do for the community. It's big.
Yeah, thank
'Cause we
you.
have big problems. We have big city problems in a small town.
Yep. And
Right?
we're here to,
Big city problems in small town. I mean, the building downtown, like they put more shit up, which means more stuff you have to go deal with.
yeah, more people.
More people. Mm-hmm. Yeah, you do a hell of a job.
Thank you.
Tracy
Neil.
Van Hoyt.
Thanks
Years
for
ago,
having
you were
us.
right, honey. Yeah, you were right.